Let me go back a little bit to some of the facilities maintenance issues that were raised by some others previously. As you know, we've got a $2.02 billion backlog on priority facility construction projects at IHS, a further estimate of $14.5 billion to meet all of IHS construction needs, and yet the health care facility construction request is $77.7 million less than what was provided in FY19. I think it goes back to Senator Tester's question about, how do you address this within this year's budget? So, question to you, with what has been proposed and given the extraordinary backlog that we face on construction projects, how do we clear this up with this level of funding? And I worry about the backlog, but I also worry that if we're not able to catch up on backlog, this will have impact on ongoing construction projects as well. So if somebody can speak to me about where we are with the backlog issue and how this funding level really meets the needs.
Thank you, Chairman Murkowski. And I would definitely categorize our request for healthcare facility construction funding this year as one of those difficult choices that we had to make with rules-based budgeting. I'm going to ask Admiral Hartz to speak more specifically about what the dollar amount that we requested means to our timeline and being able to meet the grandfathered list. And I'm also going to ask him to speak to the beyond the grandfathered list, the other facility types that we've heard many of our tribal leaders tell us that they would like to begin to propose, things like detoxification centers and residential treatment centers and specialty referral centers. So if you could add that as well.
Thank you, sir, and thank you, Chairman Murkowski. As I previously indicated, as far as that grandfathered list is concerned, with the continuation of the big increase we got in 18 and 19 up to 243 million, we now have resources into all of the projects that are on the grandfathered list. So at least we've touched all of them that total that $2 billion. Although we're looking at
But let me ask you about that, because we all know that it's one thing to say, okay, we're going to throw a few $1 million here to just kind of get something started on design. But then if you don't have funding beyond that, is this throwing good money at something that is not going to see fruition? I mean, this is the worry that I have when you've got this kind of a backlog. And so now you've put some money towards it. Now it's an ongoing project, but you are significantly delaying the implementation of that project if you can't adequately fund it going forward.
Actually, of that $2 billion, 3 projects account for over $1.5 billion.
Okay.
So.
And how far along are those 3?
One of them's got $15 million in it. I mean, we're just getting to the top list of the inpatient facilities. We put a priority on ambulatory now for a number of years. That's how we got to a number of the projects, major projects in the Southwest, in Alaska, and with ERA money, with other resources, we've been able to do that. But Phoenix Indian Medical Center, White River, and Gallup Indian Medical Center are the 3 big ones on the list right now. And of those 3, 2 of them, Phoenix and Gallup, we're looking at site issues, but we put the $2 million in to just get that update all of the planning, because they've been sitting there for a long time. Let's get that updated. Let's see what we could need to have, whether it's multi-story, et cetera. And I won't go into any more details on that. But the authorities that the committees have given us to do phase funding is how we have tried to progress on these projects. So with with that money that's in the White River project, that would be, it's adequate to do the design and get started on foundations. But we would rather have the resources to be able to roll right into construction, but we just don't expect we're gonna get, $500 million on some of these projects in one shot. So we'll have to do it on a phased approach. And that's what we've done in all these others. We work through phases. As far as the projects right now that we're looking at, everything's on track for Boataway Gap, for Albuquerque projects. We got 2 of them that'll be going there. How will we keep up with, at that level of 243 million? We have been getting what we refer to as NEF money, non-expensed funds, from other appropriations within HHS. We have gotten a sizable amount of money over the last few years to address not only these projects, federally owned projects, but also for projects of M&I of various types. And we're optimistic, based on what we've been advised, that we will be able to supplement this appropriation request with additional NEF monies to sustain, hopefully, that same level.